Today's May 1st, by the way, in case you weren't paying attention. It's not April 31st. It's May 1st today. It is May Day. It is also today the first day going into effect of Canada's new, the federal government's new, dental plan that will basically is designed to provide seniors 70 and older who would be covered starting today. But from everything I read, it's one thing in theory and another in principle, given the fact that so many dentists, it seems, have decided not to opt in, if you will. Thought we'd try to find out more. Dr. Aaron Burry is CEO of the Canadian Dental Association. Dr. Burry, thank you for your time. Let me begin by asking that question then. The promise here is really, really big. Is the delivery going to be the same?
So I guess you probably said, fairly clearly that where we are right now is just at the very beginning of this journey. So what's been announced today is a very limited amount. There's a lot more details to come forward, and I think that is having an impact in terms of dentists considering, how the program is going to work for them and their patients.
All right. So when I said in terms of dentists simply deciding that they want no part of this, how does that, or when does that begin to change in your mind? What's it going to take for dentists to simply say, no, we can live with this. We want to be able to be part of this. What do you think?
So I think at this point, there's a lot more information to come forward. So if you look today, for example, they just released how this program is going to work with some of the different provincial programs around the country. So that's a piece of information that wasn't available as of yesterday. There's a lot more of this to come between now and the end of the year. So as of July, for example, there's another submission system that is being brought up by the government to allow for submission and so on, and coordination of payments. But there's no details available on that as of yet. So that's a different thing than the current process. So there's a lot of things that are still in flux in this program.
Okay, which is, of course, not going to be very comforting to someone who figured, today's the day, I'm 71 years old, I can finally go see a dentist and get whatever I need done. The recommended, by the way, I should point out, these are 70 and over, but if you're 65 to 69, my understanding, doctor, is you can basically apply today as well online. Is that correct?
So, yeah, they're doing a phased-in, from what we understand, a phased-in application. I mean, I think the big thing, and you've just said it earlier, is the notion is going to a dentist, but not everything's going to be covered. There's a very limited schedule currently of covered services. There's a lot of things that are routinely done or needed, particularly for seniors if they need sedation, as an example, that isn't available at this point and won't be available until after some point in November. And there's about processes of how you're going to apply for that, how that coverage gets put in place. That's not 100% concrete at this point. So that does impact a lot of dentist decisions in terms of, can I really start seeing people and can I treat them properly with what we have available now?
So if you can elaborate on that, people might think that given, when someone says you can go to the dentist for free, it means you can get everything done for free. But to your point, there will be limited things you can get done. Can you just run by what those would be as the plan stands now?
So, I mean, as the plan stands now, it will not cover everything. And this is not a free program. The government is offering basically a very good subsidy, but it doesn't cover the full cost of care. There are things right now, for example, if you've been waiting to get a crown, that's not going to be covered. If you were waiting for a specific type of denture that requires pre-authorization under this program, that's not going to be available. So there's a limited amount of care that's available right now. It may be a good start for some individuals. If they've been seeing a dentist regularly and so on, it may be a reasonably good coverage. If you haven't been in a while and you've got some extensive needs, there may be other things, or as I mentioned, if you need sedation or major surgical intervention that requires general anesthetic, those things aren't coming on stream until later in the year.
Can I ask then, with respect to, dentists who I'm sure you have spoken to, what's the reluctance here from them? Is primarily the lack of information? Is that what you're getting mostly?
There's a lot of lack of information. There's also, how is this actually going to work? I need to understand how it works. And how much extra work will there be for my office?
Right.
Because there are pre-authorizations, there's extra work that's associated with this. Is this all going to be electronic? How long is it going to take? Are the things that I'm going to be recommending to you, particularly as a senior or particularly vulnerable populations, which this plan is going to be servicing, this plan isn't specifically designed for those groups of individuals. You have to make application for the additional types of care that they often require.
Okay, the one other thing I would point out, and correct me here if I'm wrong, if your dentist who you've been seeing isn't a registered provider under this plan, can he or she still accept you under this plan?
That is what only comes on stream in July, from what we understand. Is it allows the whole notion of people not having to be a registered provider, but being able to submit basically on a case-by-case basis as they do in other situations. So that pathway has not been opened up. We had advised the government that certainly a lot of dentists did not want to fully register or be involved in that enrollment process. What they wanted was the ability to function more like they normally do. But again, that doesn't come into effect until July 8th.
Okay.
There's still no details on that at this point.
And if you have access to dental care coverage already through an existing program, like a public program, can you still qualify for this?
So that's where the information just came out today on how they would coordinate between the two programs. And in some instances, the answer will be yes, depending on the province and where you are in the country. So again, that information is just coming out today. And that's a key thing that's missing for many patients. If they were covered under a public program in their province, this is a better plan. Can I get access to this? Now some of those answers are starting to come in, and that's very important information for an office to have in order to be able to say, how will I coordinate this between two programs on your behalf?
Okay, last question. With respect to, when people hear free, and you mentioned obviously not everything in here is free, there'll be cost to cover regardless, but will this, whatever procedure you're going to have, would it be at a better rate than an existing public plan, or has the government sort of broken that down?
This is a very different. It varies by province to province in terms of that. What the government has established is a certain rate that it's going to reimburse at the federal level. In some cases, that may not be near what is the traditional or the usual and customary fees as taught in that province. How that works with a provincial plan to get it there, all of that's to be worked out. Wow. Those details are just coming in now. You
confident that this is actually going to fly at the end of the day?
At this end of the day, certainly there are, as with any implementation, especially one like this, when you're this early days, people do have access to some care, and that's always a good thing. We wanted to see people being able to have access to some care, but again, it's not going to be perhaps as much as they've hoped for, and in particular, if they've been delaying treatment, they may find that not everything they thought was going to be covered is actually covered under the program.
Better something than nothing. All right, Dr. Burry, thank you so much for your time. Appreciate it.
My pleasure.
Dr. Aaron Burry, CEO of the Canadian Dental Association. Obviously, yes, it varies from province to province, but a lot of loose ends here, it would seem. But there you go.